Methotrexate, what you need to know. Hello, my name is Lizzie and I am part of the rheumatology team at University Hospitals of Derby and Burton. If you have been prescribed methotrexate, this video will help you understand how it works, how to take it safely and what to expect while on this medication. What is methotrexate? Methotrexate is a medication used to treat inflammatory arthritis such as psoriatic arthritis or rheumatoid arthritis. It belongs to a class of medications called disease-modifying anti-rheumatic drugs or DMARDs. It helps to calm the immune system, reduce inflammation, improve symptoms such as pain, stiffness and swelling, and also protect your joints from long-term damage. Methotrexate is not a simple pain medication. Rather, it is a special drug that affects your immune system to keep inflammation in control. It is necessary to take this medication as per the advice of the rheumatology team to ensure safety and prevent its adverse effects. How to take methotrexate. Methotrexate is taken once a week, either as a tablet or an injection into your tummy or thigh. Always double check that you have been prescribed the correct dose. Methotrexate tablets should only be 2.5 milligrams strength, so always make sure that you receive 2.5 milligram tablets from the pharmacy. In addition to your weekly dose of methotrexate, it's important to take folic acid to help reduce possible side effects like mouth ulcers, nausea or diarrhea. Folic acid is usually taken on all days except the day you take methotrexate, though the exact number of days may vary from once to 6 times a week based on your rheumatologist's advice. When will it start working? Methotrexate takes time to work. It usually takes around 12 weeks after reaching the right dose for your condition before you start noticing the benefits. It's important to keep taking it as prescribed, even if you do not notice any improvements immediately. Your rheumatology team will monitor your progress and adjust your treatment if needed. Side effects and safety precautions. Like all medications, methotrexate may cause some side effects. The most common are nausea, mouth ulcers and fatigue, which usually improve over time. Some people may also notice hair thinning or hair loss, although this is less common. Rare but serious side effects include liver problems and lung inflammation. It's important to remember that these are only possible side effects and many people do not experience them at all. Please remember that while you are taking methotrexate, if you develop a persistent dry cough, severe shortness of breath or yellowing of the skin, you should stop taking methotrexate and seek urgent medical advice. There are certain medications that you need to avoid taking while you are taking methotrexate. For example, trimethoprim, an antibiotic used to treat urinary infections, as they can cause serious interactions. Always check with your GP before starting any new medication. Methotrexate and alcohol. Because methotrexate can affect your liver, it's important to limit alcohol intake. The general guidance is to stay within 14 units per week and have at least 3 to 4 alcohol-free days. Sun sensitivity and precautions. Methotrexate can make your skin more sensitive to sunlight, increasing the risk of sunburn. Always use a high-factor sunscreen and avoid sunbeds. Blood monitoring. Regular blood tests are required to ensure methotrexate is safe for you. You will need a blood test every 2 weeks for the first 6 weeks, then monthly for the next 3 months, and, if stable, every 3 months thereafter. These tests monitor your liver function and blood cell levels. If anything is abnormal, your rheumatology team will contact you. Pregnancy and fertility considerations. Methotrexate must not be taken during pregnancy, as it can seriously harm the developing baby. Women should use the most reliable contraception while taking methotrexate and continue for at least 3 months after stopping the medication. If you become pregnant while taking methotrexate, inform your rheumatology team immediately. Men can usually father children while taking methotrexate, but it is still best to discuss family planning with your GP. Methotrexate and surgery. If you are due to have surgery, you do not need to stop taking methotrexate before or after the procedure. However, if you develop any signs of infection related to the surgery and started on antibiotics, you should pause methotrexate and seek further advice from your rheumatology team. Travel and vaccination advice. If you are on methotrexate, you should have the flu vaccine every year. You will also need the pneumococcal vaccine, which is usually given once. It's also important to keep up with your COVID-19 booster vaccinations. However, live vaccines should be avoided while taking methotrexate. If you are planning to travel, check with your GP before getting any vaccines. What if I feel unwell? If you feel unwell and develop symptoms that might suggest an infection, such as a high temperature, sore throat, or a persistent cough, stop taking methotrexate and contact your GP. If you're unsure about whether to continue your medication when unwell, call the Rheumatology Advice Line on 01332 787 710 for guidance. Additional support. Managing your arthritis with methotrexate requires patience and regular monitoring. The aim of treatment is to achieve low disease activity or remission over time. With the right care, most people achieve good disease control and an improved quality of life.